Hi, everyone. Welcome to the final of the concurrent sessions. This is the clinical track. And so our final speaker for this session is Casey Bland. Ms. Bland serves as the provider quality coordinator at Blue Cross and Blue Shield of Mississippi and is the primary lead for its maternity quality model. In this role, she collaborates with key partners like the Mississippi Perinatal Quality Collaborative and CHAMPS to support healthcare teams' initiatives for implementing evidence-based best practices in all clinical settings caring for mothers and babies. Casey has over 20 years of nursing experience and a background in women's services and senior level clinical leadership. She believes that the work being done through the maternity quality model is important as we continue to work toward a healthier Mississippi. Today, Ms. Bland will be presenting Blue Cross and Blue Shield of Mississippi Maternity Quality Model. There will be a few minutes at the end of this session for questions, and you can enter your questions in the chat box throughout the presentation as they come up. So thank you, and now I'll turn things over to Casey.
Hello, everyone. Thank you so much, Laura. It is great to be here to participate in this year's CHAMPS conference. I am, much like I'm sure everyone else, we were so accustomed to joining in person, but today has been absolutely wonderful. And I just want to thank the CHAMPS team for bringing us all together virtually this year. So as Laura shared, I am with Blue Cross Blue Shield Mississippi, and I work specifically with delivering network hospitals and providers to focus on implementing best practices to really focus on improving maternal infant health outcomes in Mississippi. And so as she shared, I don't work alone. We don't work alone. We have really great partners like CHAMPS, like Mississippi Perinatal Quality Collaborative, headed up by Dr. Charlene Collier. And so today I wanted to take this opportunity to really share some of the great work that these healthcare teams are doing to really improve the care of moms and babies in Mississippi. So I like to start with this slide. If you've heard me speak before, this slide may be familiar to you, but I think it's a great visual to begin with because it really highlights the proactive, comprehensive approach that Blue Cross is taking to improve health outcomes in Mississippi. We understand that the road to a healthier Mississippi begins with a healthy baby. And we also understand that in order to have a healthy baby, you have to have a healthy mother. And so these programs that you see here are Blue Cross Blue Shield Mississippi initiatives. They are quality-driven and quality-focused initiatives that really work together to impact outcomes. The programs that you see on the left side are really taking a proactive approach to focus on preventive wellness. They really take the opportunity to ensure that the care is patient-centered, to ensure that patients have easy access to care. And again, the focus is on optimizing women's health outcomes even before they become pregnant. Once a woman has decided that she wants to have a baby or is already pregnant, we do have the Well Mother Healthy Pregnancy Program that's in place to really link moms with our wellness coaches. Our wellness coaches are IBCLCs, they are registered dietitians and nutritionists, and they focus on supporting that mom and her family unit throughout the pregnancy. So once the mom has gone through pregnancy and it's time for delivery, what you see in the middle of the screen is the maternity quality model. That is a hospital-focused quality program that, like I said, I work very closely with all of our delivering network hospitals to implement key components that are quality focused. They are aligned with national benchmarks and national best practice standards. And for those hospitals, once they meet those goals, once they have achieved those national benchmarks, we have what's called the Blue Distinction Center of Excellence in Maternity Care. And that is a national recognition. That is a national quality designation that is put forth by the National Blue Cross Association. And I wanted to just pause a moment to really shout out 3 of our network hospital teams that recently achieved this great designation. So I wanted to take time to applaud and congratulate the Baptist DeSoto team, Baptist Golden Triangle, and the Sing River Ocean Springs team. So those are our 3 network hospitals in Mississippi that have achieved this blue distinction for maternity care. Again, congratulations. A lot of hard work goes into making those goals. Lots of collaboration with multiple disciplines on the healthcare team, collaboration with providers, as well as other members of the healthcare team. So just wanted to take a moment to congratulate those teams and really highlight the work that they've done. So after the mom has delivered, the programs that you see on the right are in place to, again, focus on optimizing women's health. We want to make sure that the mom's postpartum recovery is appropriate, that she's receiving services in a timely manner. And we also have the Pediatric medical home that is in place to ensure that children get a great start. Again, that program too is focused on wellness and preventive care and other metabolic management. So I wanted to start with looking at why these programs are so important to us. What you see here is a snapshot from the Health of America publication. It's a national publication that's put forth by the Blue Cross Association on a routine basis. But last year, they did a special report on maternal health. And it looked at trends that they were seeing in pregnancy and childbirth across the nation with Blue Cross covered members. But what was interesting is that what we saw with this population mimicked and was very similar to a lot of the trends we're seeing nationwide, regardless of payer in all women. And so on the left side, you'll see that the data show that there are physical conditions, pre-existing conditions that we are seeing increase in women. There's more hypertension than there was 2 or 3 years ago, more type 2 diabetes, more obesity. And also of concern is that there are more diagnoses related to behavioral health conditions. There's more substance use disorder, anxiety, and major depression. I think what's interesting about this data with the mental health conditions is that this data was taken from 2015 to 2018. And we've already seen so much data come out about the impact on our mental health and well-being that the pandemic has had. So I would not be surprised if we continue to see these numbers increase. On the right side, they also looked at how those pre-existing conditions are driving some of the pregnancy-related and childbirth complications. And again, here, we are seeing the same increases that are concerning. There's more gestational diabetes, more preeclampsia. And then for the childbirth complications that you see down at the bottom of the screen, those are mostly aligned with our SMM that we measure, the severe maternal morbidity measure that is a measure that CDC tracks. It's something that we track internally at Blue Cross Blue Shield Mississippi as well. And these are unexpected outcomes. You know, mom has one of these conditions or has to have a certain procedure. That is not the optimal experience for her childbirth. And so we definitely want to make sure that we're not only monitoring these conditions in our women and our moms, but that we are putting programs in place to help support healthcare teams, improve care, and mitigate some of the risks that are associated with these conditions. So what are we doing about it? I talked a lot about the programs that we have in place on that first slide that I shared. And to the left does include the Blue Primary Care Women's Wellness Home. Those are 8 clinic groups that we partner with very closely to really focus on metabolic management. And when I say metabolic management, I'm talking about we are working with these teams to help support them manage the women that have hypertension, manage the women that have diabetes. And that's really important because if we can support them manage those conditions, even before the woman becomes pregnant, once she does become pregnant, we are likely to see a healthier pregnancy. And a healthier pregnancy is likely to lead to a healthier baby. And so these are our 8 OBGYN clinic groups that we work with. That is a model of care that is expanding and growing. I foresee an additional 4 or 5 clinics that will start that women's wellness home journey over the next year or so. So what are these women's wellness homes doing exactly? When you think about home, we want it to be their place to go for all healthcare needs. And so these groups are focused on improving health outcomes for women across the care continuum. We want to make sure they have access to care, for the care to be proactive, patient-centered, high quality, and cost efficient. And so one of the other things that they focus on in this metabolic management are biometrics. Each of these clinics collects blood pressure, cholesterol, and blood sugar levels on a routine basis, at least annually at the patient's wellness visit. There's a very smart logic that happens behind the scene when these numbers are entered that assigns a risk status level to each patient. And so your risk may be healthy, your risk may be low, moderate, or high risk for developing certain chronic conditions. And that's really important because, again, what we are hoping to do and hoping to impact is those delivery outcomes. And so it's through the integration of what's going on in the women's wellness home with metabolic management, with the women's wellness home, those initiatives and the maternity quality model, we really are expanding the focus from only looking at, hey, how are you managing high blood pressure in this woman, to how does that management of the high blood pressure impact her delivery outcomes when she becomes pregnant. So that's where we're trying to move things. How are these women's wellness homes doing? They're doing very, very well. This is a relatively new model of care that's been introduced. We have been working with these teams for just a few years now, but already those groups are exceeding the benchmark in wellness visit utilization. They're also leading the network in blood pressure control. Again, that is huge, especially when we think about the impact that high blood pressure can have on a pregnancy, can have on that infant once that infant is born, and the premature birth rates that we know are definitely a concern in Mississippi. And so we are definitely seeing improvement. We are moving the needle. Things are going in the right direction. When we looked at the 2020 data of the patients that were attributed to one of these women's wellness homes, over 9% have already had an improved risk status. And so that means that they have moved from either a higher risk status to a lower risk status. They may have moved from moderate risk to healthy risk. And so that is something that we'll continue focusing on, again, making sure that we are being proactive in our approach to manage these conditions and help support healthcare teams manage these conditions. So next, I want to share a little bit about the maternity quality model. As I shared, I work very closely with delivering network hospitals and have had the honor of doing so for the last few years since I've been at Blue Cross Blue Shield, Mississippi. But these teams work so hard to make sure that babies and moms are getting the care that they need. So I wanted to just highlight a little bit about what the maternity quality model included. It includes 4 key components that you see here. Part 1 is the prevention of early elective delivery. That's a component that probably most teams may be familiar with. It aligns with the March of Dimes effort that was in place several years ago to basically eliminate those non-medically indicated early term deliveries. Since then, we've introduced a bit of a shift, a bit of a transition with part 1 to focusing on what's our rate of 39-week delivery overall. And the reason we've made that shift is because we've also transitioned focus to, again, that women's wellness home. We want to make sure that as we are supporting those providers in metabolic management of those chronic conditions, over time, we are hoping to see that translate to healthier babies, more full-term babies. Part 2 is neonatal appropriateness of care. That is the component that looks at the sicker babies, the low weight babies, or less gestational age babies, to make sure that they are delivered at the most appropriate level of care according to those AAP level of care guidelines. We want to make sure that if they are requiring a higher level of care or some type of specialty intervention or surgery, that is done so in the most proactive manner, in the most timely manner. Part 3 is the baby-friendly hospital designation, which I know we've talked a lot about already today. That is a key component of our maternity quality model. We work very closely, as I shared, with CHAMPS in that effort. And so we are elated to share some of the same progress that I know has been touched upon earlier. Part 4 is our focus on the implementation of maternal safety bundles. And these are AIM bundles, the Alliance for Innovation on Maternal Health. Right now, the maternity quality model includes 3 of those bundles. We have focused on hemorrhage, we focused on severe hypertension in pregnancy, and we are doing a pilot with the 3rd bundle, the safe reduction of primary cesarean births. And so that component, we partner very closely with the Mississippi Perinatal Quality Collaborative to help support teams implement these bundles and maintain those elements. So I wanted to share a little bit about the progress that we are seeing so far with the maternity quality model just this year. We track and trend data as we continue to work with teams, and we've already this year seen an upward trend in the rate of 39-week deliveries. Again, that's important because if we can make sure that baby gets to at least 39 weeks, we know there are improved outcomes associated with that. Over 80% of our network hospitals are actively engaged in implementation of the severe hypertension safety bundle. That's really important because that is our focus for 2021. We have been working on hemorrhage for several years now, but the focus right now is on severe hypertension in pregnancy. So to see that a majority of our hospital teams are actively implementing that bundle is really optimistic and great. And then we've also seen a downward trend in primary C-section rates for those teams that are participating in what we're calling the iSupport project. As I shared, we began that bundle with a small pilot group. We started with 5 hospitals at the beginning of last year, and despite COVID and all the competing priorities that came with it, those teams remained diligent and focused on so much of the work that goes into that bundle. So it was great to see that those teams have already seen a downward trend in their C-section rates. And then we've added 4 new hospitals to the iSupport project this year, making it a total of 9. And so we are excited to continue that kind of small group approach. It does allow us to have great one-on-one conversations with the facility, the women's services team, and their providers. And then last, I wanted to share that over 90% of all of our network hospitals are either in D4 of the pathway or designated baby-friendly, which is tremendous. I didn't think we'd get here so fast, but with the help and support of CHAMPS, we are so excited to see that so many of our Mississippi hospitals have achieved designation. As I shared before, we don't work alone. We are so fortunate to have CHAMPS and the Bauer Foundation that continue to help support teams to designation. So let's talk a little bit about breastfeeding. I know you've probably seen this slide before. This data was actually shared with me by the CHAMPS team. but it speaks to the progress that we have made in what I believe is relatively a short time. The CDC data that was released in August shows that Mississippi breastfeeding rates, initiation rates, are at 70%. We have come a long way. I've talked to teams before, and tracking this data, I can remember when we were sitting in the 40s, 40% breastfeeding initiation rates. And so to see us move to 70% really speaks to the hard work that teams have put into place to ensure that these babies are getting the best start. Where we do see opportunity is in our exclusivity rates and breastfeeding rates at 3 months out and at 6 months out. And this slide does speak to that opportunity. This shows any breastfeeding at 6 months in Mississippi did increase from 27% to 39%, but drastically different from our initiation rates. And so we've got lots in place planned for this year to address how we can continue to support breastfeeding after the mom leaves the hospital. So one of the things that we are excited about is we are working with CHAMPS to assess the prenatal education in some of our OBGYN clinics. Specifically, this touches on and addresses step 3 of the 10 steps to successful breastfeeding. And I'm sure you all are familiar with this, but step 3 is discuss the importance and management of breastfeeding with pregnant women and their families. Because I work with so many teams all the time, they have clearly shared that there is opportunity here. We know and understand that this is a culture change. This is a community change that really has to take place in order to sustain the progress that's been made. Part of that progress really is impacted by the quality and the quantity of breastfeeding education that mom receives prenatally. And so the CHAMPS team has done a great job in developing this prenatal breastfeeding assessment or survey. The goal of this survey is to identify opportunities in prenatal breastfeeding education in order to improve breastfeeding rates in Mississippi. And again, I talk about sustaining that progress that's already been made. So a little bit more about this assessment. It is intended to go to prenatal clinics. It includes 4 key components. We ask that clinic to provide information about specific clinic characteristics, the level of staff training as it relates to breastfeeding education. We ask what that breastfeeding education looks like. How often is that education disseminated? How is it disseminated? And then we also ask about other clinic practices. And so for us at Blue Cross Blue Shield Mississippi, our next steps are to partner with some of those 8 women's wellness home clinics that I shared before. We want to start there. We want to assess the data, and hopefully after that, we'll be able to expand this survey, this assessment out further into the network so that we can get a better picture of what's going on with the prenatal education and where there may be opportunities to improve. So I wanted to also take a moment to highlight where the baby-friendly hospitals are, and again, those that are very close to designation. Of the hospitals that are still delivering babies in Mississippi, there are 21 that are already designated. And so about 39 of our network hospitals still deliver. 21 of those, like I said, are designated. Those are the red stars that you see here. 90% though of all of our delivering network hospitals are already in D4 or already designated. And so folks are, even amidst COVID, have made progress and are on their way to designation. I think what's great for the network is that 80% of these babies were born, at a baby-friendly hospital last year. And so that is something that we are elated to see and very optimistic about. But as you can see here throughout the state, folks are doing a great job with reaching designation, and only a handful of folks are not in that place right now. So I talked again on that first slide about the programs that we have in place to help support healthcare teams with best care of their patients, aligning it with best practices and standards of care. We are also working with 25 pediatric clinics in the same way we are working with OBGYN clinic offices, in the same way that we are working with our delivering network hospitals. And so there are the 25 here within this region that we're starting with. Again, this is a program that we intend to expand as we move forward, but this is a relatively new program as well that we just started. Again, we are helping to support these teams focus on wellness, metabolic management, and mental health. One of the things that we have started within these 25 pediatric medical home clinics is to already start conversations about breastfeeding. We've already started conversations with these teams about their level of training for their staff. If a mom comes in and she's having problems breastfeeding, do you have someone on staff that can help that mom, that can provide additional touch points to that mom as needed? We also want to make sure that we are putting processes in place to address sustaining those breastfeeding rates. Initiation rates are at 70%. We know at 3 and 6 months, those rates drop off. And so at the beginning of this year, we started tracking breastfeeding status in these pediatric medical homes through what's called their wellness plan. In their EMRs, there's a section to document on that's called breastfeeding status. And we are asking these providers to give us information about their patient's feeding status. And so you can select from exclusive breastfeeding, exclusive formula feeding, or if the mom is doing both. And so again, that gives us a good way to assess where there may be opportunities to impact some of those breastfeeding rates. And then last, I'm so excited that we are able to offer a certified lactation counselor training this year, again, helping to support moms and help sustain those breastfeeding efforts throughout the state. Several years ago, we extended this offer to network hospital teams and did an in-person course. Due to COVID, we made plans to transition to an online training this year. And so I'm so excited that we are able to offer all of our women's services staff at network hospitals, in addition to those pediatric clinics, to participate in this training to help support their journey to baby-friendly designation and to continue to sustain breastfeeding rates and help support moms as needed. If you're not familiar with the CLC Certified Lactation Counselor Training, it is something that is offered and proctored by the Center for Breastfeeding. It's a comprehensive management training that focuses on practical skills to make breastfeeding a success, strategies for special circumstances, babies with that are preemies or that have Downs. And then there is a component that talks about effective communication with moms, which I always reiterate to my teams. That's so important. How you talk about breastfeeding, how you approach a mom that maybe has never breastfed or no one in her family is breastfed. Just wanting to make sure that a level of respect is maintained. You're meeting the mom where they are based on their needs. So it's great to see that this program also talks about effective communication with moms. So that's just a little bit of what we have going on at Blue Cross Blue Shield Mississippi. Again, just wanted to take time to really make sure that we are highlighting so much of the work that the hospital teams are doing, because they are what is making the change and what's making the difference here in Mississippi. So thank you again for the opportunity to present.
Thank you so much, Casey. It's a great presentation. We have a few questions. We have time for a few questions.
Sure.
A few questions have come up on the chat already. And as we talk, people feel free to continue to enter your questions into the chat box. So the first question for you is there a plan in place for implementing postpartum home visits for maternal health and breastfeeding?
So right now, that's not on our radar. We do have specific processes in place. Like I said, on the right side of that initial slide, there are programs in place to ensure that the postpartum recovery period is appropriate. We want to make sure that those women's wellness home providers and really any primary care physician that the woman is going back to see for her postpartum care is supported. And so specifically related to breastfeeding, there's nothing in place right now, but there are other programs in place to ensure her postpartum recovery is successful and that she's receiving great care in a timely fashion.
Great. The next question we have is the variable of mother returning to work or not entered into any of these breastfeeding rates?
Absolutely. And the data is there that shows, there's a percentage of moms that are going back to work, and it completely correlates with the drop in those breastfeeding rates. One of the things that we do have on the radar is to look at who are the key stakeholders in breastfeeding success. The mom is definitely a key stakeholder. Her support unit is a stakeholder. The employer is a stakeholder. And so that is something that I'm not sure we've really touched before, but ensuring that the work culture that the woman goes back into is supportive of breastfeeding, understands the benefits for the community at large for breastfeeding is on our radar. And it's something that we definitely have planned to really have a focus with employer groups and workplaces to ensure moms have what they need.
Excellent. We had a comment that I just think it's important to read. And one person said, I love that you say here that, excuse me, I love that you say there is an opportunity here rather than saying care is lacking at this time. Prenatal education is so important and the opportunity is huge there. And I think, Casey, you're always very positive whenever you're speaking with the clinics. And I think you keep that kind of positive message when you speak directly with the clinics themselves too.
Absolutely. And I will say this, one of the things that I do love about this maternity quality model, and I'm not sure if I touched on it during the presentation, is yes, I am from Blue Cross Blue Shield, Mississippi, but we work with healthcare teams that serve all Mississippians, whether that mom has insurance or no insurance at all. We emphasize that we want all moms to get best care. We want to make sure that these facilities have really hardwired into their systems these best practices. And so while I'm here, representing Blue Cross Blue Shield Mississippi, I always want to emphasize the importance of reaching all moms everywhere, impacting all moms' care, all babies everywhere. And that is why it's so important to me that we have really great partners in CHAMPS and the MSPQC as well, because we want to make sure we are aligned and moving along the same trajectory to impact moms' health.
Great. I have another question for you. Is the maternity quality model being implemented at any other Blue Cross Blue Shield organizations across the nation?
It's a great question. Not that I am aware of.
Okay, follow-up question. I think they expected you to say this. If not, what is the best way to get something like this started? So maybe in their state.
Sure. So that's a great question. What a lot of folks may not understand is that there's a National Blue Cross Association, and then there are local plans. Mississippi is a local plan. And so that quality model, we have that is something that we advocated for and developed. That is not something that necessarily came down as an instruction from the National Association. The National Association does have strategic frameworks and guidelines and recommendations. However, those local plans from state to state are independent entities. So, I am always open to talk to other plans about developing something similar. As I shared, I think it's a great model because it does just ensure that these hospital teams are addressing care for all moms, not just Blue Cross covered moms.
Excellent. We have a kind of a simple question. When is the online CLC training?
So that is, that invitation was sent out in April. We are expecting to open that course June the 28th. Right now, we are at about 70% capacity. The deadline to submit those forms is Friday. If any of the network hospitals or clinics are in the viewing audience, get those forms in. I expect it to fill up completely by Friday, and we hope next year no pandemic will occur and we'll be able to transition back to an in-person training. But for right now, June 28th is when the online course will open.
Excellent. Hopefully we do have a couple hospitals in the audience who will benefit from that message. Have you partnered with WIC, or has Blue Cross Blue Shield partnered with WIC to optimize from their years of learning and experience?
I'm sorry, your screen froze, Laura. Say that one more time.
Oh, sorry. So have you partnered with WIC to optimize from their years of learning and experience?
So that is a partnership that we have not, I think, fully taken advantage of. It's something that we are definitely open to. I have worked specifically with CHAMPS and in coordination with some of the WIC team when we have really targeted folks that may be struggling a bit on their progress to baby friendly, but it's not something that we have done since I've been at Blue Cross, but definitely something that we're open to.
Excellent.
Great question.
Let's see. So I think we have a few more minutes. So the next session on the main stage starts at 4:10 Eastern. So we have a few more minutes in this room. So I'll wait. Sometimes there's a bit of a delay in some of these questions coming through. Let's see if any other questions come in, or if I've missed anything. A lot of kind of awesome work, comments too, Casey, just for you. I think people are excited about this.
Great.
Oh, and I do see, so Kimberly Ramsey from WIC is the breastfeeding coordinator from WIC. It does say she's on, and she does say that, Mississippi WIC is open to this partnership opportunity and would love to connect. So Casey, if you haven't connected yet with Kim too, we can always connect offline too. I can help the two of you, but you may know each other already. So
sure. Yeah, I'm sure we've met at some other events where there's a shared goal. So yes, definitely open to having that dialogue. Thank you.
And then Anne too from CHAMPS, she would like me to thank you for your excellent leadership at Blue Cross Blue Shield of Mississippi.
Thank you.
And I want to just echo her too. We've had a great relationship with Blue Cross Blue Shield. CHAMPS has. We had Sarah Broom kind of in your position before this, and we were so happy and excited when Sarah stepped down from her position, you took over. It's been really great, and your leadership has just been a really positive force in the state.
Thank you
so much.
I appreciate that. Thank you.
All right. And then one other question. Are there any plans to publish any of the breastfeeding data, or does Blue Cross Blue Shield ever publish their data?
So sure, a lot of what we do is published through the National Blue Cross Association. That Health of America report is a national publication. You can go online and download it. There's some great publications that were released in that summer report that focuses on some of the work that's being done in the Women's Wellness Home and their affiliated hospitals. So it's a great podcast. It really highlights the work that's being done down in the southern part of the state. But a lot of the data that would be published from local plans is captured in that national publication.
Excellent. I guess my kind of question for you too is, where do you kind of see the state? Maybe so CHAMPS has been in the state since 2014. So maybe over 6 years now. Where do you see the state in 5 to 6 years from now? Your work with Blue Cross Blue Shield.
Sure. So I think that's a great question. And, we're always forward thinking and thinking about the next project to take on to make a difference. 5 to 6 years from now, I certainly hope that every delivering hospital is baby friendly. I am hoping that we have been able to sustain the breastfeeding initiation rates and been able to move the needle with those breastfeeding rates at 3 and 6 months out. One of the things that is definitely on our radar is to address racial health disparities and address equity. Currently, that is something that we are aligning with the National Blue Cross Blue Shield Association. There is a strategic plan that is in place to impact those outcomes. And so I'm really excited about that work and excited to be a part of that work. And so those are things that I would like to see. I want to see those gaps close. I want to see our breastfeeding rates sustained. And I also want to see movement with our women's wellness home model. I want to see those clinic folks that continue to be proactive in managing these pre-existing conditions. I want to see that translate into better outcomes for our moms, more 39-week babies, less sick babies, and just better outcomes from that aspect. So lots of work to be done. Again, great partners make all the difference. And so I'm excited about the progress that has been made, but equally as excited about where we can go.
Excellent. So I think this will be our last question. We still have a few minutes left. And it's probably not an easy question to answer, but if you could give people just a few kind of nuggets of information or pearls of information. Can you speak to the buy-in for hospitals or how to start the conversation to get them on board with work like this?
Oh gosh, I'm a nurse by background, and I'm a nurse by background. I was a nurse, I've been a nurse for 20 years, and I can tell you with transitioning from the hospital setting to the setting, at Blue Cross Blue Shield Mississippi, it's really expanded my view of the challenges and barriers that hospital teams have. I have not met a team yet that doesn't want to see safer childbirth and better outcomes for moms and babies. The desire is there, but there are barriers and challenges to making it happen. There are barriers and challenges that are unique to each facility. And so I think it's about starting a conversation first, being able to develop a rapport and a relationship with these hospital teams to adequately assess what their barriers are so that you can really individualize support for those folks. And so I think the desire is there. I think it begins with a conversation to really identify what their unique challenges are.
Great. Well, thank you very much for your presentation. So now this is the end of all the concurrent sessions. So you can move now over onto the main stage again. We're going to hear from Eileen Fitzpatrick, who is the new director of Baby Friendly USA. And so if you have any questions about navigating, you're going to go to the left side of your screen, go to the agenda tab, and then you can click into Eileen Fitzpatrick's session. But thank you again, Casey, for your presentation and for your leadership in the state.
Thanks, Laura. Thanks, everyone. Have a good one.